me come by and say, "Oh,
Somebody else.
seriously,
I think that's great.
we
I
need to
love
do
to see
it."
that.
All right, so Foley, talk a little bit about yourself, your background, and your practice, if you don't mind.
Okay, I will do that real quick here. Foley Nash, licensed professional counselor and supervisor, licensed marriage and family therapist and supervisor, and appraisal privileged. I started out in life as a school teacher in the public schools in North Louisiana. So I have a teaching certificate from all of that time period, still valid. They never let us go. With English, Spanish, German, French, and K through 12 secondary counseling certification. So that's the part that I started with. What I'm currently doing is I'm a member of the Marriage and Family Therapy Advisory Committee on the Louisiana LPC Board of Examiners. And in the work that I've done leading up to that at this point, I am currently the Director of Clinical Programs for Anthem that serves Medicaid for about 300,000 Louisiana members, physical and behavioral health. And prior to that, I was the behavioral health director for several years for Aetna, which also served Medicaid, fewer members, about 140,000. And then before that, okay, so I have a managed care track record here. My previous managed care track record was with Magellan Health Services, which operated the Louisiana Behavioral Health Partnership and the Coordinated System of Care program. The partnership operated from 2012 to 2016, and Coordinated System of Care is still operating. I was the Children's System Administrator for that behavioral health partnership, and that covered about 800,000 eligible children in the state. So we would have anywhere from 35 to 50,000 or so in services at any given time, coordinating with various child serving agencies like DCFS, OJJ, Department of Education, so on and so forth. So that was all very interesting. Prior to starting there, I worked with an ACT team, assertive community treatment team, and using some forensic work as well. So it was a FACT team, if that means anything to you guys. And prior to that, I operated as an executive director for a group home for 15 teenage delinquent boys who were all in state custody. So a checkered past, if you will, and a track record with a whole variety of things. So at this point, I do the private practice. I'm supervising people for licensure and doing the occasional consultation, and then to work with the LPC board.
So Foley, Brittany kind of shared with us a little bit about some things she wished she had known before going into and setting up a private practice. And I know you've been doing this for quite a while. What do you think are some of the greatest challenges of operating a private practice? What are some things that students need to know before they get into something like that?
One of the things that we never get, or never used to get, I never got, was operating the business end of a private practice. Learning about who you can bill with, what kinds of services you can bill for. One of the things that we've envisioned from time to time has been, I set up a private practice, I rent an office, and I go in there and people come to see me. That's it, you know? And that's not it, as we know, Brittany. So one of the things that we have to consider is the complexity of who you make arrangements with. Commercial insurance companies, Medicare, Medicaid, various kinds of payers, things like that. Yeah.
That LPC still cannot take Medicare.
Right.
That's the ongoing struggle right now. It's one of the largest, the largest providers still that does not acknowledge LPCs as a servicing provider.
Right, still stuck on social workers, yeah.
Yeah.
Mhm.
Yeah, so that's something we've got to advocate for at the federal level.
Yeah. So one of the things I wound up doing when I got started was, as you can see, I have been doing this for a while. Okay. I started a private practice in 1984. Okay. It's okay to say, wow, I do that every now and then myself.
So it's older
But
than me.
But at that point, I predated licensure in Louisiana. Licensure didn't start for LPCs in Louisiana until 1988. And at that time, the reason that I did what I did was that the best place to get insurance was, and probably the only place to get insurance for your own personal health and family needs, was through an employer. So my career plan started out from the very beginning to be working full-time. So I would have those benefits and whatever else came with that, and then do part-time private practice, which is what I've been doing since '84. And then when I retired from the full-time stuff, I'd have the private practice to supplement retirement income. So that was basically the long-term career plan.
How much longer do you think you'll still be practicing, Foley?
Oh, let's see. I have probably 2 or 3 more years that I can do comfortably in the full-time work with the managed care organizations. And then after that, I'm open because one of the nice things about this profession is that as long as your brain still works, you can still do this. Okay. So I have the brain working, I think, for a little while longer. So we'll see what happens. So.
That's, one of the things I love about going to LCA is seeing the passion of people that are in the profession that just don't ever want to retire. They just, they just want to continue to work and help people. And it's beautiful to see. I still, working here at Southeastern, Peter Emerson keeps talking about retirement, but I don't think.
No,
I don't
he
think
can't
that's gonna
retire.
happen.
He can't retire.
So, yeah, he's been around for a little while. So it's good. I love seeing the faces of the experienced counselors and learning from them. I've, fully come to quite a few. I was telling the students quite a few of your presentations on supervision, which have been super helpful. And you're always so willing to share your paperwork and your documents that you use. And I always appreciate that. So.
Thanks. That's some feedback that I get from time to time, that some of that is useful information for people to have. And one of the things I find is that when somebody is looking for supervision, they're also looking for somebody who has a degree of organization about how they do the supervision. And quick story, had one girl who came to me years ago, got a lot of the paperwork about the organization of the supervision, and found out that her employer was going to provide supervision, which they never did. So 6 months later, she came back to me. And at that point, she told me she had talked to a lot of people about supervision, gone through the list on the board website. And she said, I hope she was exaggerating, that she had talked to 60 people about being supervisors and got a whole variety of responses. Like, oh yeah, I got that credential, but I've never used it. Or no, yeah, we can do that. You'll be my first one. Come on, stuff like that. So that sort of influenced her decision at some point in time.
I bet. So I have a question for both of you. How do you make sure that you have to be able to pay your bills, right? How do you make sure you're profiting off of your business and doing it ethically and responsibly? How are you making sure you're covering your overhead, but also generating enough income that you can support yourself? How do you balance that?
You want to jump in, Brittany? I will jump in after you.
Well, what I did was I calculated my personal costs, like outside of the business. I calculate my basic business expenses and got a figure. I also looked at what I put away for taxes, as well, since we pay estimated taxes quarterly to the IRS. And kind of looked at, okay, so this is the basic amount I need to make. And so kind of looking at, so about how many sessions would that look like a week? Like what's, and also particularly what type of client. So if you're more solely Medicaid, or if you're more solely commercial, that does affect things. So kind of just looking at that, because you're also with month to month, sometimes week to week, you have variances, because sometimes you have cancellations, people get sick, people have emergencies, people go on vacation. Like I have a client that's basically been gone most of the summer. I haven't seen her since May, almost 2 months, because she's been out of state with a parent. So like some months are just going to, like for me, I found the summer to be a little bit slower. Once school hits, it will likely very much pick up. So because some of my kids aren't showing issues as many issues for the summer, because school is a big trigger for them. So there's sometimes like I'm like, it's a slow week. So like maybe this many, and then I have much busier months where I'm taking in much more income. So for me, it's also, I make sure and look at savings. So making sure that I'm prepared in case something happens, because I am self-employed, because I don't do another full-time, that I have backup in case something happens to me. So like there's like an emergency and I can't work, or if I want to take a few days off and have vacation.
Right.
I got to be able to balance that, because being able to have a good work-life balance is also important. So you have to be able to be like, okay, this is a comfortable level. This is not a comfortable level. This is not where I can make a living. So, and some of it may vary depending on your living situation. I'm a single woman. I don't have children. I'm not married. So it's just me supporting myself. Some people may be in a different situation where they have a spouse that works a little bit more. And so maybe they don't have to pick up as many hours as maybe I would. And they have insurance through their spouse or partner, whereas I have to provide my own. So those is just all these different variables you have to look at and what works for you. So.
I would second all of that, and add in there that a lot of times there's an additional impact when school is not in session, because if there are family issues that are going on, very often it's school that identifies those and generates the referral to the counselor. Yep. So that's very, very interesting. I've supervised a number of school counselors, and they have some anxiety about what happens during the summer, and certainly during the pandemic, when some of those kids who have terrible home situations are stuck at home and can't come to school and talk to the counselor. So yeah. Mm-hmm. So in addition to all of that, I would toss in the fact that there are multiple payer sources and source types that you will want to look at. For example, commercial insurance pays better than Medicaid. Okay, so that's getting on the panel and getting paid whatever the commercial insurance will pay. And then you have to factor in, okay, does this person have a deductible for their insurance, or do they have a copay or a co-insurance that they have to pay and I have to collect from them? So there's that in there as well. So that's part of where the revenue comes from. And then also there are other types of things. For example, if you're with a commercial insurance company, I'm with 2 or 3 of those, then they may also ask you if you want to sign up to be part of their employee assistance program provider panel. Okay, so I've been doing employee assistance since 1984, before the license was even required. And it's a very helpful kind of thing, because there are several different rates that the EAP companies provide. And they're making a profit because they're charging a higher rate to the employer companies in order to be able to provide this service. So the way it works is the employer promotes the service to their employees. Employee John Doe says, I need some of those services. They get the number to call EAP, and EAP says, oh, well, we have Foley in our panel. Yeah, he's right there near you. Go see him. And you're authorized for 3 sessions, 6 sessions, 5 sessions, 8 sessions, whatever it is. and they don't have to pay anything for that. And the employer gets billed for that, but the EAP company pays me whatever the rate is that they've negotiated with me for that. Another perk for the EAP provider stuff is that counseling is not all they provide. They provide training on work-life balances, supervisor training, critical incident responses if there's, say, a death in the workplace or something along those lines. And those are much more lucrative kinds of things than just the regular client session. For example, because I work full-time, I sometimes have to turn down or take time off for some of those critical incident response kinds of things. But typically, they will pay anywhere from $60 to $80 per hour for your travel to get to where you're doing the critical incident response. And then it's, for most of those companies, it's $200 an hour for your first hour on site and $125 an hour for everything afterward. And then you're contracted for X number of hours on that site to deal with those issues with both the employees and the supervisors and so on. So there's more than one way to do that, pay your source kind of thing. Plus you also have the self-pay people. And I guess we can talk about sliding fee scales as well, if some of those are in there.
Well, interesting fact, because it's something I looked at. If you are on a panel for an insurance company, that client cannot be self-pay.
Right.
I looked into that with
Yep.
a client who was not accepting the insurance at the time. I was still working with the insurance to get things straight because, like I said, sometimes they don't have great follow-up.
Right.
And so they were self-pay at the time. We had negotiated a rate. And I had let them know once I get credentialed with them that that's going to change. So if we want to continue the therapeutic relationship, we're going to do whatever with your insurance. And you can't just say, oh, well, you don't have to pay the copay either. They're by contract.
No.
Yeah, you have to, they have to pay the copay except for very, very extreme circumstances, from what I've read. But so if with me, on several panels, there's not very many I don't take. So there's one right now, because like we discussed, is Medicare. LPCs are not recognized Medicare provider. She was on a different insurance and the mom changed it. And now she's on a strictly Medicare. So we moved to a self-pay so that I can continue seeing her because she did not want to switch therapists. So she's like, I will do self-pay because we know you're not credentialed. I explained the whole thing to her. So I was like, but if y'all happen to move back to a plan that I take, you will no longer be self-pay.
How do you make that decision to get on an insurance panel? Is it more lucrative for you to do self-pay versus to be on the insurance panel? Or does it just depend on your location and the population that you're seeing?
I would say both. So where I am, I have a lot of low income. So it's better served for me. I may not be able to do my self-pay rates.
Yeah.
Right. And if you're practicing in Louisiana, Louisiana is a very rural state for the most part. And not only counselors, but medical providers and so on are affected by the fact that we're classically considered in the vast majority of our parishes, 50 some odd parishes, are considered to be in medically underserved areas. So that there are actually programs that encourage and entice medical providers like medical assistants, physical therapists, doctors, etc., to get their credentials, and then they're awarded a stipend to help get the credentials in return for working X amount of time in one of those medically underserved areas. So if that's an area where we are located, like Brittany and I sometimes have been, then that becomes a factor because obviously there are issues with transportation in the rural area. There are issues with the general average income of the population within that parish or region. And that's very, very difficult to make ends meet if that's all you're depending on. So, yeah.
What do you do if a insurance company says that the client that you're seeing, they're out of sessions? They've exhausted their number of sessions, but you feel like the client still hasn't met their goals or is in need of continuing counseling?
Yes, that's the medical necessity. You have to be able to argue that and be able to have documentation to prove that.
Right.
And
Every insurance company requires that, except for most outpatient services, that somebody has met the criteria for medical necessity. One of the things about working with managed care, which I'm sort of into at this point, certainly, is that managed care, for the most part, does want people in outpatient sessions because that's cheaper than inpatient sessions. So going in the hospital is several $100s a day, whereas seeing a counselor once a week is considerably less than that for the insurance company to pay out. So they like that, but some of them do also, like you say, set limits on how many outpatient sessions you can have. So you have to be able to be aware of what they consider the criteria for medical necessity for those services, so you can document that and make the case in case you have to appeal that.
So then what I hear is if you have to document medical necessity, you're operating at that point from a medical model as compared to the wellness model. Because if the person is just wanting to come to counseling for personal growth or developmental or
if you want,
just wellness, then that's not really medical necessity from an insurance perspective.
if you want to build the insurance, you have to have a code. So even though we're taught not to diagnose in the first session, insurance companies require you to be able to bill under something. So
Right. They want a DSM or ICD-10 diagnosis for the most part. That's one of the reasons that I like the employee assistance program work, because they don't communicate back to the employer that pays them to pay me. And a lot of the employee assistance programs really and truly don't want a diagnosis as much as they want a statement of what the problem is and a resolution plan. So it's a different kind of ball game that way. So a lot of the EAP services are a little more workable. And there's some insurance companies, for example, that won't pay for marriage therapy. So that's not considered in medical necessity for them for outpatient services.
yeah.
So then what do you do if that person has insurance and you're on that insurance panel and they want marriage counseling? Can you not see them?
It depends on if, oh, go ahead.
Well, I was going to say, I want to say, if one of them is like an identified client with almost a valid diagnosis, like anxiety, depression, and it affects the
Right.
relationship in the marriage, or
Right.
what's going on, that can be billed. But
Right.
and if neither one of them is really presenting with like really that necessity, it's kind of be more of out of pocket. And I actually had a friend of mine that it was private. They had to do private pay, so that pocket self pay.
Can you see
Yeah.
them for marriage couple counseling if they have an insurance and you're on that insurance panel, but they're coming to see you for couples counseling? Can you then have them do private pay?
If the insurance company, and here's one of the things with the managed care stuff, if the insurance company denies coverage based on this is not a covered benefit within our
Yes.
plan, then you are basically exempt from that requirement, because the insurance company is telling you, we're not covering that.
Gotcha.
So your relationship with us is irrelevant. So it's only at that point your relationship with the client that matters, and that's where you get into what Brittany was talking about, the self-pay arrangement with the client.
Good. Now, Foley, I know Brittany shared with us that this past year, for the first time, she hired a CPA to help with taxes. Do I remember that right, Brittany?
Mhm.
So do you use a CPA Foley to help, or do you do your own business taxes?
I do a tax preparer
Mhm.
for some of that, and I am also able to cheat a little bit. My wife is the billing and collections person for a medical practice of 4 doctors, and I'm sorry, 5 doctors now. So she's been doing that for a long time, and if I ever have any difficulties with some of that, I have an in-house resource, shall we say, for helping with some of that.
I was
So,
gonna say, that's not cheating, that's using your resources.
okay, there you go. All right. Nice reframe. Good, thanks.
And how about attorneys? Do either of you all pay for an attorney on retainer? What would you do if there were a legal problem? How do you handle?
That's why you have liability insurance.
I was going to say, that's where the professional liability insurance comes in, because one of the benefits of your professional liability coverage is that you have a network, actually a national network of their attorneys that they keep on retainer to handle cases that come up with any of the professional liability issues. So what I see, I have supervisees who are now in private practice and consult back with me on some of these things. So I tend to refer them back to their professional liability insurance carrier. And then they report to them if there's even an allegation. If there's not anything that's substantiated at this point, then if there's even any kind of allegation, take that to the insurance company, because A, they want to know, and B, they can advise you better, and they can also connect you with one of their attorneys, which will be at no cost to you, up to like, what, $25,000, I think is the insurance coverage for the attorney, in case they have to actually go to a licensing board or a deposition and defend you in some way.
It depends on your coverage. Like I actually just renewed mine. So I don't remember which one I chose, but yeah, it's at least
Yeah.
that.
I'm with HPSO, and
I'm with
my,
CPH. Yeah.
okay, yeah. My coverage is a little different because there are a couple of ways you can set yourself up in private practice. And one is to use your own social security number. So you're basically a sole proprietor, and you can operate that way and separate the business and the personal income if there are two sources like that. That's a challenge, because if there is an adverse decision regarding any complaint against you, then because you used your personal social security number, everything you have is at risk. So your house, your car, your everything is at risk that way. So one of the things that exists out there is multiple other kinds of business models. So I started out with this sole proprietorship that way, using my social security number. And after I skated for a few decades without anything terrible happening, then I decided, okay, let's go to the limited liability corporation, which basically serves to limit my liability only to business assets if something bad happens. That costs more, but it's worth more.
And that's what you said you have, right, Brittany? You have the LLC.
LLC. Yeah.
And neither one of you has employees. You are just your own practice.
Yep.
Right. That's for me. Yeah. Mm-hmm.
Great. So I often say in this class that counselors do not practice without risk. There is always a level of risk involved in what we do. What would you say are some of the greatest risks that come with having private practice?
Risk. Yeah. Ethical decision-making, dual relationships. If you work in one of those lower income communities or even a small community, it's very difficult to avoid dual relationships. So one of the things that's built into my and probably your declaration of practices and procedures is that confidentiality extends to a certain range of things, so that if my client and I are both in, let's say, Walmart together,
Mhm. Can't say
with or
hi
without a
first.
mask, okay?
Can't say hi
Then
first.
I can't say, hi, how are you doing? Unless they do something first, and I explain to them that's a
Not ignoring you.
confidentiality protection for them, because they don't know what the people who are with me know about
Yeah.
what I do for a living. And I don't know the people who are with them, whether they're people they would want to know that they know a counselor.
Yeah.
So,
Like- Like me personally, I've seen a therapist in the past. And what's really fun is I've run into her at LCA, which I have no problem talking about that I've been in therapy, identifying her to other people. And it's still the same rule applies. And so she didn't say hi to me till I said hi first. And so even among professionals, if you like happen to see your therapist out and about, same rules going to apply.
right.
Awesome. What questions do you guys have?
So when it came to getting like your location open, did you have to go through like the fire marshal and LDH and all that for them to approve it?
Hold on, I didn't quite hear that.
Did you
I
have to
couldn't
go
hear-
through the fire marshal and Louisiana Department of Health and when you were opening up your practice, or?
I did have to have an inspection from the fire department. So
Sometimes that depends on the jurisdiction
Uh-oh.
and the building that you're in. I have had multiple locations and just consolidated those because of now having teletherapy as an option that we didn't have as much of before. So in those other locations, not all of them, but some of them have required a jurisdiction's certificate of occupancy, so that the
Occupational
fire
permit.
marshal has to come and you get your occupational license that way. And then you wind up through them getting referred to get verified as to whether or not you need to collect sales tax and report that, different kinds of things along those lines.
OSHA, years ago, when I worked in a hospital setting, I know OSHA was a big thing, which is some type of safety thing.
occupational safety
Yeah.
hazard. Yeah.
Yeah, Occupational
it's like
Safety and
workplace
Health
safety.
Administration. Yeah. Mhm.
And I'm guessing your business liability covers any potential like falls or any,
Yeah.
they got hurt in the building somehow. That's
Yeah.
what-
I have license on my site,
Mhm.
insurance on my site that was required through my lease. So not only do I have like liability insurance on the business, like I have insurance on the property. So
And then so that's multiple insurances, because then you also have personal liability for you.
well, my personal is under the business
I gotcha.
because I had to update it, not being just like in a school system, that I specifically had a business. So it's a more cost. So it was making sure I had updated that because that was something I was not aware of. I'd make sure to go have that updated.
Yeah.
And for a lot of your business operations, you wind up having to register the LLC, for example, with the Secretary of State's office.
Yes. She's setting up the business.
So is that easy or is that an arduous process?
That's actually pretty easy. You can do that online nowadays.
Yeah, that's not bad. Yeah. Mhm.
I've walked 2 people through it. I had to go look up some of my answers because I couldn't remember how they were answered, but yeah.
Mhm.
What other questions do y'all have? Have y'all ever received a subpoena and had to appear in court?
Not yet. Not yet.
Knock on-
I've had
knock on
request
wood.
records from a lawyer, but not a subpoena to appear in court.
Okay.
I have had a little bit of that, but it was more not so much me being subpoenaed to appear in court, but sometimes they want the record And I've also had an interesting occasion where the Mental Health Advocacy Service wanted to help us at the hospital I was at work with a particular child. And we could not locate the guardian to get permission from the guardian to speak to the court. And what the psychiatrist and I wound up doing was going to court with the mental health advocate and requesting the judge to order us, which is the required process, requesting the judge to order us to disclose what we knew about this particular case. So then they could take whatever legal actions they needed to follow that.
Oh, yeah. I feel like I had one more question I wanted to ask y'all, and it's escaped me for a minute. What do you guys have?
I actually have a question. Once opening a private practice, I imagine at the beginning, it constantly feels like you're falling behind or always have something to do. How long until you feel kind of like it's steady and you're somewhat caught up, if ever?
Truthfully,
Wow.
never. You may feel more in control.
Right.
Always stay on top of your notes.
Uh,
I had time built in, but I had time built in between my sessions for like cleaning purposes and so none of my clients would overlap. That became the perfect time for me to make sure my notes were done directly after my session when my memory was fresh.
Right.
And I didn't have to worry about it later. Because if you let them build up, if you have a healthy clientele, so you say you've had 30 sessions a week, if you don't do them, you got 30 notes to do.
Right.
So you get them done, you can usually knock them out good 5-10 minutes, maybe 10 minutes. Usually if I'm distracted, it takes 10 minutes. My focus is off, but usually I can get it knocked out in about 5.
And a
And
lot of
then-
the electronic medical records will supply you with, or allow you to supply yourself a template for notes so that you can use
Beautiful
the template.
template. Click, 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 type, copy from the treatment plan, type, boom, save.
So what system do you use, Brittany, that you like?
I have been using Simple Practice for, I tried out other ones. It was the third one I tried. So it was a little bit after I started. So almost 3 years.
Okay.
So, and it does my scheduling, it does my billing, it does my reminders. Has electronic secure cloud. It has a telehealth platform. So
It's HIPAA
secure
compliant.
messaging. I
Yeah.
mean, I enjoy it. So I know everybody has their own preferences on what they like. That just happens to be mine.
Yep, most of the electronic records tend to have similar bells and whistles now for their components. I've been with mine for close to 10 years after I gave up paper and tried to do that. So mine is therapyappointment.com. It also has the template system, the opportunity to choose between HIPAA compliant notes and other kinds of notes so that you can generate psychotherapy notes that are more protected than your general progress notes. And it has a teletherapy component, and it also connects to a billing service, which is useful for anything that you're billing for, except for the employee assistance programs, because each one of them uses their own set of forms, unfortunately.
I did remember my question. This will be my last question, and then if anything the students have, and I appreciate y'all's time. I know so this is ethics class, right? And one of the things we've talked about that is an ethical, it's in our ethical standards, is to have some type of backup system for your notes in case something happens to you. Like what would happen if you were in a major accident or something happened to you and all of a sudden your clients could no longer see you? type of plan do you have in place for your clients and for the notes?
Okay, for 22 years, I had a shared office with Ken Benedict, who is no longer with us.
Oh,
And
yeah.
Ken and I were sort of the backups for each other and served as consultants as well, because he and I had both been involved with ethical areas. I think we were both the ethics chair at one point for the Louisiana Counseling Association, different years. But after Ken left the picture, then what I have done, I have for my electronic record, my wife has access to that and can generate reports for anybody who needs that. She has a separate password and different kind of access to get some of that information.
Nice. You are
That
so
is
blessed.
Actually
You're
sounds
blessed
like
to have
something
your
I
wife.
that is on my, that needs to be on my to-do list. So,
Yeah.
so that's something, because like I said, this is not something that's always talked about or taught. So
Right.
something
Yeah.
for my to-do list.
Mhm. Yep.
So
Just something to think about, right? Hopefully there's never a need for it.
Hmm.
Last questions from you
Well,
guys?
there was a close call just recently. The company I used to work for, Aetna, had me doing lots and lots of reports. And I kept telling them, you don't need to have a single person in charge of doing this. That's a bad business practice. You need to have other people doing this, have somebody in other departments who can be involved with this. And they never did. So in February of this year, I was fortunate enough to catch COVID and go in the hospital. Okay.
Oh, no.
So got it from my doctor's office. Okay. But went into the hospital and was completely out of commission for at least a week. And it was only earlier this month that I actually finished my physical therapy stuff for that. So I lost 20 pounds, 10% of body weight, all kinds of wonderful stuff. And the company, while I was out, didn't do anything about the reports that were due. They were coming up. And when I got back to work, they had saved them all for me. So
Wow.
I'm thinking, what were you guys thinking? You didn't even know if I was coming back, much less when in time to get the reports done. So it's not just us in private practice that sometimes will not plan ahead. Sometimes it's the big players with the insurance companies and so on.
Yeah. Well, I'm glad you're doing better. You look great.
Got back most of my 20 pounds. So we'll keep that going. So yeah.
What last follow-up questions do you guys have?
You asked all the good ones.
I guess when you said the lawyer was asking you for your progress notes, like how did you go about that? Like, did you have to send them, or did you speak to somebody about like not really wanting to send them?
if you're not sure of what an attorney wants or needs, you can always clarify. Some of them just want a letter of like saying this is when they were in receiving services, so many
Right.
times they attended. Some of them want more complete stuff. So there, if you're not sure, ask them to be specific. What are you asking of me? And only releasing what is required. I had one that was very clear in their letter. They wanted their full medical record. So not just the letter. So they wanted their claims forms. They wanted, that's all the billing documents. They wanted the progress notes, all that information, any invoices I generated. So, which I provided.
And a lot of times, if you talk to the attorney, there are a couple of factors that are involved there. Sometimes you can make it clear that based on what you're telling me you're looking for, this information is going to hurt your client and not help your client. So you may not really want this information, okay? But then there's also the other question of sometimes all you have is a subpoena that basically means the attorney went to court and got the clerk of court to issue a subpoena. And that doesn't have the same force of law as if the judge has ordered the records to be released. So you can check on that and then certainly pursue what avenue, develops out of that. And certainly in all cases, consult with client about, hey, do you know that so-and-so is looking for your records? Can you help me
Yeah.
figure out what that's about? That kind of thing.
Great. Anything else, guys? Well, Foley and Brittany, I'm gonna stick my head in the camera for a minute. Thank you so much. I really appreciate y'all giving up your time and sharing your knowledge and expertise with my students. I know that they appreciate it. So even though they're on different tracks, I know that this is something that they're thinking about. And hopefully you'll get to meet them in person at the LCA conference. I know it won't be this year, but maybe in 2022. So
Okay, sounds good.
thank you all so much. Y'all have a great afternoon.
Thanks.
See you
Thanks,
later.
you too.
Bye.
Bye.